many times was did she address that on the record? And I just feel like she just was. That's why you didn't really see her a lot in the media, other than the press conferences. So we'll try and get her. 6:52. Someone we can get right now, Dr. Hoa Nguyen from the Governor's Physicians Advisory Group. Obviously, a man we definitely want to talk to, as we are seeing a rise in the number of COVID-19 cases. Of course, they kind of explained it away on the military side by saying that, oh, these are the airmen, they're isolated on the base. But now we come to find out last night that we had 14 positive COVID-19 cases not on the base, outside in the community. And we'll get Dr. Nguyen on to see exactly what he can tell us about that, if anything. Good morning, Doc.
Good morning, guys. Morning.
Good morning.
Good morning, Sabrina, Chris.
You sound very grave this morning. Is that?
Gosh, I'm almost scared to ask a question. What's going on?
No, we all scratch our head too. It's a big spike. 16. We don't have that for a long time, but those are not related to the Air Force.
Right.
Positive. Okay. This they're not cluster. They're kind of everywhere. So that's sometimes it's not a good thing, because we rather have in one place. But the good part about the majority of them are kind of there's no symptom or very mild symptom. I think 4 of them are symptomatic, more symptomatic than we can worry about, and I think 1 end up in the hospital. So we have 1 COVID positive in the hospital. So we have to kind of look at all the positives, and we have to be take back and do some PSA again for the public that as we open more establishments, we have to really follow the mask and social distance. It's very important, because it's where if we going to start have some more positive in the community or not, we find out the next weeks or so, because we open more. So we just have to be re-educate the public again to be very cautious and not let their guard down again. So we just hope for the best. We still, I think, still going to go to PCOR 3, because the 7-day average, we kind of in the borderline. But I think we still going to go PCOR 3 for now, I think.
Oh, that's just going to freak everybody out.
When are you hearing that we're going to go into PCOR 3?
I think by the end of this month. So the next few days.
Are you looking at the governor also lifting this public health state of emergency on 1 July or 30 June?
I'm not sure. That's a very tough call, just because we definitely don't want to go backward. We definitely don't want to do that. But
what if we have to?
It's not going to be a good week.
Doc, what if we have to go backwards because of this spike? I mean, do you think that we should move into PCOR 3, or from a medical perspective, or do you think we should remain in PCOR 2, or do you think we should go back? Because I feel like this 5-day rolling average, we were holding that out as the gold standard of what it took to roll us back. But now that like you said, we're borderline in meeting that, now we're saying, oh, the hospitalizations, there's only 1. So just curious, because it kind of seems like there's a difference of opinion between those who want to reopen everything from an economic standpoint and those who are in the medical community. They seem a little bit more cautious in that when we talk to people from public health, when we talk to the doctors, they seem very key on reiterating how serious this is and how we shouldn't take it for granted and how we should, stay home if possible. So there seems to be a little bit of mixed messaging here. So that's why I want to ask, what's your opinion on it?
We right now PCOR 2, and most of the business is open already. The only thing is not open to tourists. PCOR 3 can open to tourists, and we're never going to get to PCOR 4 just because we have no vaccination treatment. But in reality is, we can open to tourists, but no tourists going to come, because right now every country have a 2-week quarantine. So, we won't see that for quite a few weeks or months or so. There's a very little between the 2 and 3, except that the tourists open. Because like I said, the majority of all the businesses in Guam are open already in some capacity. And we have to really look at our hospital, GMH and GRMC, to make sure that we have the capacity to handle if any surge in hospitalization. So that's the only major point that we look at to go from 2 to 3. Test capacity, the tracking and tracing are already in place. The number of cases, that's something we didn't expect. But again, if we look at the 5 Sunday average, we still kind of that a little bit at that borderline where you say, "Wow, it's what happened?" I think it's still safe. We still ask her to go to PCOR 3 still, and hopefully we can stay that way. Again, public health with Chima and the team, tracing team, they doing a very good job so far in tracking all these people down and working with the Air Force. But like I say, the 15 cases we have and the 560 we have the other day have no relationship to the Air Force personnel at all.
Yeah, I know you're saying that as like kind of good news, but I think it's a little scary that even though we haven't seen an impact from these airmen, what we are seeing, like you said, is 15 positives scattered throughout the island.
Yeah, I think that's part of Christopher, Sabrina. You guys really have to push this part, and the fact we're going to do the same, and really tell people to really put the mask on. And a lot of my patients concerned that we have signed that no mask, no entry.
Right.
But when they enter a certain business, they put their mask down, they walk around, and that's a no-no. I tell you, you had to put your mask on to do that. So this is not talking about restaurants that they put a mask down to eat.
Right.
I'm talking about the other store that they go in there with the mask on. But once they're inside,
right.
The employee really need to monitor, make sure that the customer always had their mask on inside the store.
Doc, you don't have to tell us twice about the mask thing. I mean, we've really, because we take it seriously, our role in the media. I mean, part of our job is to get the information that's crucial to people and to get it out there. And I think one of the most crucial things we can do is wear the mask. And people have turned it into some kind of stupid political debate, which I don't understand. It's really a public health issue. By wearing the mask, I'm not spitting in your face. And, it's just safe. It's not just safe for her, it's safe for me. I mean, I got 5 kids. They have elderly family. We're doing our part, and we're trying to really set the example. And I just got to call out some of our media colleagues because they've, really, it's a bad example. And I think with people watching us all the time, I want to set a good example. I want to say stay home. I want to say wear your mask. I want to say wash your hands. So we're taking it serious, Doc, and I just really wish that all of our colleagues across the board in media would do the same and not treat this as some like Republican Democrat thing, because it's really not. I mean, it's really Republican, Democrat, COVID doesn't discriminate.
It doesn't. And the other one too is that people on home quarantine, they really need to be on home quarantine. There's between home quarantine, there's a restricted movement. But the home quarantine, I would say that we've backed about 50% of our folks are truly home quarantine, and that's where you have to worry about people that come in from off island, including the state. If you are home quarantine, we really have to have your home quarantine and not go around and back to quarantine. We bat about 50-60%. And that's what the danger is about, having people flying in from off islands. On our meeting, we come up with, things change every day, and people criticize why we change every day or every meeting, every week that we come up with new idea, just because situation around the world change every day. So we come up with new guideline again, and it's going to take probably 7 weeks to come up with this thing to kind of have people try to test out of the home quarantine a little bit earlier. But we try to catch the most positive as possible. But we're going to try to get people off the home quarantine. Some new guideline going to come out soon. It's a lot of heated debate in the PAC group to try to move this thing forward. We have 7 weeks to try to work this thing out, but we really need to somehow, because we have the testing capacity, not like we have unlimited testing capacity, but we have enough to roll out this thing as a program to see if it works, to make sure that the home quarantine at least get tested. Because right now I tell you, people are going out when they are supposed to be home quarantine.
Right.
And also ask people that if they have any cough and cold, do not go to work, and you have to go see a physician. And don't show up to work, because if you're positive, you are going to affect a lot of people. And sooner or later, if you have a positive work case, just imagine you have to send your office worker home for another 14 days, and we don't have no worker anymore. So it's very important people really pay attention. It's like Chris said, you got to respect your colleague, you respect other people around you, because it's just not an easy thing, And the other thing is that we really have to pay attention to all the positive. It doesn't matter if they're symptomatic, not symptomatic, because the young, because most of them are young right now, and there's a few older ones. But if you have a positive on a young person that have mild symptoms, guess what? Sooner or later, they're going to pass it on to their elderly in their family or their neighbor, and those are the high-risk patients. Our hospitalization will go up if we don't pay attention to the mild symptom that's positive for COVID-19. So it's a lot of education out there. We have to do the public in order to keep our island go and continue on PCOR 3. Nobody want to go back to PCOR 2.
Right.
But if we have to, we have to. I feel like that we're just not going to go backwards, and that the government, that we're firm on, we're going to reopen tourism no matter what.
If our hospitalization go up, we have one right now. We don't have one for a long time. GMH used to be 0 for a long time. We have one. So hopefully the trend does not continue to go up and it continue to go down. But I say it needs the whole island to work together in order to keep where we are. Okay. So.
I wanted to go back into that home quarantine. So you're saying that there may be this change in the protocol where people that are on home quarantine, which would probably be, Guam residents, returning Guam residents, could test out?
Yes.
Within what time frame after they land on Guam and they're at home?
We ban it from 5 to 7 days. It's a lot of logistics thing we have to look for. Guys, we have to look for who's paying for it. That's number one, right? Insurance not going to pay for it. Okay. Because that costs a lot. And, you can't expect Guam to pay for the test all the time, because this is looking for months, maybe a year. So sooner or later, the money's going to run out. So we have to look at where can people go to get tested. Not all the facility, like public health or private clinic can do testing. So they have who to do testing on those patients to test them out, because you still have to take some precaution, because you are testing somebody that potentially is positive. So those are details, the cost, where, and who monitor. That the quarantine personnel will come in on the 7 days. So those are the steps that we have to discuss and look at and put in place before we roll out the program. Just like Hoa Nguyen, they put their target is August 1st, so they have the whole month of July. It's not like they can roll out program right away, because all those are very complicated to put in place.
Okay, so target is July 1st. That's what you just said.
No, we cannot. No, July 1st around the corner. So this is going to take probably several weeks for us to come up with.
No, August 1st. You said August 1st?
Yeah, August 1st.
August 1st.
Yeah.
I wanted...
That's what we trying, but like I say, there's a lot of things have to be in place.
Okay. I wanted to ask about the government quarantine facilities, because we've been seeing numbers there with people that have been testing positive, mainly from the Philippines. And we just started seeing flights coming in or returning from the Philippines to Guam. Are you guys having any conversations or concerns about that, and also discussions about the possibility of testing when people arrive?
There's few positive from the PAL flight already, but they have been moved to days in. That's the isolation facility. So I'm not sure where they are right now, but they are a quarantine facility. But once they test positive, they will move off to the isolation facility. The PAL flights, they have like 130, 140, and there's 180 something, but a few of them have medical problems. I know that a few having exams to be quarantined at home because of medical necessity. That's what people come from St. Luke that cannot stay there. A few, but the plan is to test everybody and on the facility just to get just a clear picture of what the prevalence is of the COVID-19. Because we just need to feel comfortable before we let people go home. Because like I say, the main thing is we don't want to go backwards. And a lot of people, complain that's discriminatory, whatever the reason is. There's no discriminatory in this one. It's judgment to try to protect the island. And we're not going to do this for a long time. That's why we come up with new guidelines to try to get people, doesn't matter where they're from, to go home as soon as possible. Because there's no one like to be quarantined in the government facility. But like I say, this decision had to make to really protect Guam, and there's no discriminatory on this one.
So I'm sorry. Did you just say that the plan is to test everybody in the quarantine facilities?
Yes, the plan to test. I think they'll be rolled out this weekend.
How many quarantine facilities do we have now?
We have what the first test is Saturday. I think it's about 130. So it's not that many from the first flight. So that's the number that we are comfortable with in running it. So there's no problem with running that 130 tests. Let's just say we run almost 300-400 tests. So that's just a very doable number.
And was there any discussion on changes in the protocol for tourists that plan to or may not arrive when we reopen on 1 July?
There's a lot of talk on no tests for tourists coming in, and we right now.
No tests for tourists coming in, and no quarantine.
Even we roll out as July 1st, right? We expect 0 tourists to come in for the next several weeks or months. What you understand is that when the tourists come in right now, even we relax and everything for them, when they go back, they have to have 2-week quarantine period in their country. Nobody will come. But at least when we put the guideline out, the tour company can plan months from now. It's not just next week. Their country have to relax their policy before they can go anywhere. Japan, Taiwan, Korea, they will not let anyone come back to the country, including their residents, without have to be 2 weeks quarantine if you leave your country. So it doesn't matter what we do. They're not coming until that country relax, and we don't. Taiwan putting the dateline out sometime October. So the only way that we can look for our tourism that return to Guam is to put any type of letter out, so that way the tour company, I'm not a business, but we have to look at, listen to business people. I'm just a physician, but when we took our business people, it took months to plan for this tour. It didn't take days. So if we don't plan ahead of time, from months from now down the line, that we try to get our tourism back to the island so our people can have their job back, we would be standstill as we are right now. So the decision of open for tourists with no test or anything like that is really pending. We can put a letter out, but if situation change in Korea, situation change in Japan and Taiwan, those things will be changed again. But right now we just need to put something out there so the tour company can start planning months down the line. No tourists going to come July 1st, guys. Absolutely zero. Just because...
not even one.
Not even one. The country will not let them leave. Because they go back, they have no choice. It'll be 2 weeks quarantine. So they rather go on vacation within their country at this point. As Japan encourage people to take their vacation, their leave within their country. So it's not like they're going to come. So, people don't worry about saying there's no test or for no requirement of tourists. They don't understand the concept. The concept is start to plan for the future several months down the line, because it's not going to happen July 1st.
Okay. What about over at the Department of Corrections? The news came out last night, but the individual started not feeling well on Wednesday, tested positive yesterday. And you guys met last night, right?
Yes, we met last night.
Was that discussed about what happened at DOC?
We discussed shortly, public health on it, the person at home, and they're going to test every people there at DOC. And, the key here is that the person, the lucky person seek medical care when they sick. That's the right thing to do. And if you do that, you won't pass it to your coworker, especially if your workplace implements face-on all the time. Just like my clinic, you can't take your face off, your face mask off. And most of the business now, when you're at work, you have your face mask on. So if you do that, then the chance that you catch anything from your coworker, and your coworker respect you by, I'm sick, I'm staying home, they can't spread anywhere. So, but public health going to test the DOC, and lucky this person came early, and hopefully there's no more positive case in a DOC in the workplace.
When is the testing for? You said all the officers are going to be tested. When is that? And are the inmates also going to be tested?
Yeah, that's Chima and public health, Dr. Manglona will have to make that decision. But right now they're pretty aggressive. So,
but that's the plan, that everybody over there is going to get tested.
Yeah, no, guys, they are very aggressive, and they've we lucky part, and we are very fortunate in Guam that we have the capacity to do that at this point. If the surge get a lot more, then we're going to back the question mark. But at this point, with the number of cases we have, they have the capacity to go out there and do cast a very wide net, so that way we can catch everything that can be catch possible. So, we leave it to Manglona and Dr. Manglona and Chima, and they will make sure that they identify the positive and isolate them.
Mm-hmm.
Okay, so
Doc, so
with
public health currently working on the contact tracing for the airmen and the 30 businesses that they went to when they defied their superiors' orders. Do you think that we have enough contact trace investigators to also contact trace investigate the 15 new positive cases that we have?
Right now we have, I know public health hiring a whole bunch of more people to be in that department. For us to be open and to be comfortable, that department had to be very strong and tracking and tracing. That's the only way that we can get out of this mess. So they are high. I know Ecuador said they hired something like 40 people yesterday. I said, well, good. They need to hire a lot more, just because we need to make sure that we are all in place in case something happens. Mm-hmm. Because if they are strong, we can basically identify everyone, and we will keep our number of cases low and warm. Mm-hmm. You know, I mean, no, because right now, besides COVID-19, they have to worry about all other kind of stuff, to like, you know, TB positive and all that kind of other infectious disease. So right now they borrow people from different departments, but we as a PAC, we really push them to hire a lot more people to do the work for. They make a lot of phone calls, guys, a day,
right?
And they drive everywhere. You know, they have right now like almost 1,000 people on home quarantine. Just imagine 2 phone calls a day. Mm-hmm. That's a lot of phone calls. So,
but I thought this whole EMOCA app, I think it's EMOCA, right? This EMOCA app that Public Health announced, I thought that was supposed to help keep track of where people are and what they're doing, and you're supposed to send little videos and things like that. Is that working? Are we still using it?
You have to call. You still have to call for them to turn on the video. So someone actually has to sit there and call them.
Okay.
So that's why I say there's a lot of phone calls that have to make throughout the day, and sometimes they try to the house or spot check. So there's a lot of stuff that this team here, and I tell you, there need to be 100 of people on that team. So that way we can feel comfortable that, hey, people don't violate the quarantine at home.
Yeah, let me know. I got a few nosy aunties who would be really good contact trace investigators.
We might let the mayor involved too. You know, that's one subject that we talk about, and I talked to Melissa Salas a little bit, and we still trying to figure out what extent that we can get the mayor to get involved. If they want to get involved and kind of help, you know, make sure that people in their village and the quarantine that stay at home and not go anywhere. And the mayor can do that. They know everyone in the village, and that would be very helpful because we don't have enough people in public health to make sure they stay at home.
I guess, Doc, in closing, if you could, people waking up to this news this morning, 15 new COVID-19 positives outside of the military bases, and you're saying they're not connected with the airmen who defied their supervisor's direct orders. So what's your message to people as they wake up and kind of deal with this news in what's supposed to be the new normal?
You know, the message to people is wherever you go, be cautious, wear your mask, you know, all the time, you know, in public, wash your hands, and respect the person next to you. And if you happen to, by any chance, not intentionally, you take your mask off, and someone come up to you and ask you to put your mask back on, don't get mad at them. You know, that's the responsibility of every person here on this island to try to keep us clean. Mm-hmm. That's the message.
Yeah, also before we let you go, you know, we did speak with Linda and Pinko DeNorsi actually earlier this week about her retirement. You have anything to say about that?
Is there anything fishy going on with it, Doc, or is it just really she's tired?
Is she in the meeting last night?
I tell you, she's probably beside her going to have so much stress in her plate. Some of her employees work from 7 in the morning to 11 at night. I don't know how she can stand it, but I tell you, she has her plate so full. People can take so much stress at a certain point, and I applaud her that, you know, you have to know when you push your limits because you're going to break down if you pass your limit. You know, we go down this thing for about 4 or 5 months now, and I tell you, she got to be burned out. You know, we lost a very good person, the head of public health, but I tell you, she I think she got burned out. I mean, even I look at some of her staff there. They look like they walk on the water too. I mean, it's just like they burn out. There is so much, you know. We didn't never expect this for a small department. to be them that take on this much responsibility. But all of us, and no one perfect. She make mistake, and everyone make mistake. But at a certain point, you have to know when you have to back out. So
you're saying she's stressed? She reached her limit.
Yeah, I mean, she's stressed. And I mean, all of us are stressed. You know, my doctor's stressed. You know, I mean, and they all freaked out yesterday. And my physician, look at the number. You know, I mean, we were trying to relax the protocol in the clinic, but now, I'm glad we didn't relax the protocol because we have to go back to be very cautious on what we do in order to make sure that our patients are safe and our employees are safe. You know, so it's just a lot of stress. It's a different type of world we live in until we have the treatment and the vaccination for the COVID-19. Hopefully soon. But I just say farewell to Linda and I say thank you for everything she has done. She did a wonderful job.
Right.
Who's taking over?
I'm not quite sure. I'm not quite sure. I met with Josephine O'Madden, multiple times. So and she looks like she's fully capable.
She also has a lot of experience.
Yeah, I don't know, but Joe been there for a long time already.
How about Tom Atta? Did you hear anything about Tom Atta heading public health?
No. I just say bye to Tom and
Tim Uggan.
Tom Atta, and he's a wonderful person to work with too. But
Doc, sorry, I know we're trying to let you go, but somebody had a question about the rolling average, and I know that's Dr. Cabrera's baby, but what can you tell us about the rolling average? I know you discussed it earlier, and you basically said that we haven't met that criteria to roll us back, right?
Yeah, we haven't met. We are very close to it, but that's what they call rolling average because you don't want one spike to you don't want to make a decision on one spike, so you have to do a rolling average to kind of balance out everything, and we are on the verge, but we didn't pass it. Today we have 10 to 12 today, or we're in trouble.
Right.
Oh.
Knock on wood.
Doc, yes. I wanted to follow up on something you talked with us about a couple weeks ago about this pilot projects with the Japanese School of Guam and these smaller schools, and any monitoring what's going on with these children and these classes as we move forward to making final decisions on the reopening of schools. Do you have an update on that?
Yeah, I'm glad you mentioned it. I forgot to tell you that. The pilot program of Japanese school going as well as you can expect it. It's a beautiful program, and I know that St. Anthony and some private school are asking for the guideline, and they try to implement that too. Dr. Bird and Dr. and a few of the physicians, Dr. Dulai, in the committee, in the subgroup there, they will put a report out on the study so people would know. But it's a very successful program right now. It's wonderful. They present some picture yesterday of the classroom, how the interact each other, and like I say, I know St. Anthony are asking for the guidelines. A few of the private school are asking. So they all want to get the guidelines to try to plan for July or whatever deadline they try to open their school. But we going to present this at public health and get a blessing on them on the final report of the pilot program that have been going on. The Japanese school is open now. People are going to school. And like I say, it's very, very well put together, and there's actually no kink at this point. So this program can roll forward to the private school and to DOE. If I know they're going to try to meet with DOE, but I'm not sure where the program is. But I think the lieutenant governor take over that. So the program. So hopefully he can push this to other part of the public school also.
How many students are at the Japanese school?
Oh, they have very small. I think less than 100.
Okay.
Wow.
Okay.
But it's just very well done. I tell you, you you guys should ask Dr. Burt and Dr. to talk about it. It's really well done.
Right. We'll follow up with Dr.
We'll get him on for Monday.
Yeah, it's really. I'm very proud of them. We'll take the initial step to do that. Kids during the summer, they need to, especially special kids, they need to be occupied because they lose a lot of learning here. So, we're going to try to push it out, like I say, and get a central website that people can access to and put some picture of the school there and help the private school and public school move forward.
One thing that Dr. was mentioning when we interviewed him a couple of weeks ago was the children not wearing masks.
Yeah.
Is that true from the pictures, I guess, that you had seen?
There's still, that's a guideline that we put out, and the school has the ultimate decision. The Japanese school decided they're going to make all the kids wear masks. So every school can make their own decision on the mask. We give a basic guideline, and they can go beyond that if they want.
Okay, we'll go ahead and wrap this interview because Chris is giving me the evil eye.
I'm not giving you the evil eye. Go on, Bree.
No. This stuff interests me, but that's okay. We can check with Dr.
No, go. You want to ask him anything else?
No. I'm good.
Yeah, they will fill you out, and what they present last night. We're so happy that it worked out very well for everyone.
All right.
Right on.
Okay.
Thanks.
Okay, guys.
All right,
Have
Doc.
a good day.
Watch your stress.
Thank you so much.
Wear a mask.
Okay. Wear a mask.
I will.
Wash your hands.
Guys. Have a good day.
All right,
okay.
bye.
All right.
Bye-bye.
7:28. What'd you think of that, Bree? I told you guys.
That was a lot of information.
It was a lot of information.
Possible home quarantine testing out.
Right.
QFAX. They're going to be doing testing everybody tomorrow.
QFAX is quarantine facilities, guys.
Oh,
I know Bree's way deep in this quarantine procurement facility thing, expert. But, QFAX is quarantine facilities. So that's one of the things he said was they want to go in and test everyone in those quarantine facilities. And then also everybody on home quarantine.